Yeah.
Well, Jen, do you want to say anything before I get started? I know we had planned for you to kind of get started here, but we already have had Jeff do our wonderful introduction. So,
Yeah, Jeff, thank you so much for that great introduction. I'll just give a quick introduction to alongside before Tess really digs into the material for today. So, our work is focused on minimizing and mitigating pediatric traumatic stress, or traumatic stress in pediatrics, I should say. And the work is focused both on kind of two sides of the house. One is really focused on families and supporting families through the experience of having a child with a life-threatening illness or injury. Um, and then also focused on providers. So we do trainings like this. We work with hospital systems to work across a unit or across a whole hospital to really increase the level of knowledge about traumatic stress, both in the provider themselves, secondary traumatic stress, which we'll be talking about today, and then also in the patient families. So very, very happy to have Dr. Smith-Thomas with us today to be talking a little bit more about secondary traumatic stress. So thank you, Tess.
wonderful. Thank you. I'm excited to be here with you all and talk to you all about this very important topic. And so today, really, our goals are going to be just learning to define secondary traumatic stress and really establish the importance of integrating a trauma-informed framework into our practice, not only for our patients, but for ourselves. We will be describing the signs of secondary traumatic stress and the physiological response. So, what's happening in our bodies to these stressful situations. And then finally, we will discuss briefly how providers and organizations can mitigate secondary traumatic stress. And the next presentation in our series will focus really heavily on that third objective specifically, but we will touch briefly on it today because I feel like that's the good stuff and we don't want to leave you without anything. Um, so with that, we will go ahead and dive right in. So what is secondary traumatic stress? So the National Child Traumatic Stress Network defines secondary traumatic stress as the emotional duress that results when an individual hears about the firsthand trauma experiences of another. Okay, so as providers, that is happening pretty frequently, right? We often are hearing about others' traumas experiences, but then in addition to that, as providers, we may actually even be participating in the trauma of others in the form of medical traumatic stress as a healthcare professional. And so when we talk about secondary traumatic stress, we're talking about kind of both of those aspects. I just want to note that secondary traumatic stress, there are a lot of terms kind of in this realm that are all related. And so I want to just point those out in case you hear these other terms. Um, and you can kind of know, okay, this is all kind of falling within that same bucket, although there are some small nuances to each of these terms. But compassion fatigue is one of those terms, and it's really just thinking about that diminished capacity that a healthcare professional experiences when we have distress about witnessing the suffering of our patients. And then we also have burnout, which is another term that is often used. And we also have vicarious trauma. These all are essentially describing similar things. Burnout is a little bit different. That is related to just kind of that emotional exhaustion that comes with doing this type of work. And then we also like to think about compassion satisfaction, which is kind of that opposite of compassion fatigue. Um, and is really more of like those positive feelings that come from being in a helping profession and the meaningful work that we do in the healthcare setting. So when thinking about implementing trauma-informed care, I think that it is crucial to highlight SAMHSA's definition and how they kind of define a trauma-informed framework. And we'll use this framework today to really talk about secondary traumatic stress. But so a trauma-informed organization is one that realizes the widespread impact of trauma, recognizes the signs and symptoms, and then responds and resists re-traumatization. And so we will talk about kind of each of these four things today, and we'll use this framework throughout. But what I do want to highlight before we dive into those four R's is that what is truly necessary in order to fully mitigate trauma in the healthcare setting is systemic change. I want to highlight that every person that interacts with the system in the organization is impacted by trauma at some level. And so when we think about implementing trauma-informed care, it really needs to be implemented from the top down, and we need to implement things within the organization and create system changes that will help impact and reduce and mitigate trauma for our providers, but also will reduce impact on our patients, our families, and the caregivers of our patients. And so we will be doing later on in this series, we'll be talking much more about the impact on families, patients, and their caregivers. But today, specifically, we're focusing on you all, the providers, and secondary traumatic stress. So why does all this matter? Why does implementing trauma-informed care matter? Why should we be paying attention to secondary traumatic stress? Why should we be paying attention to trauma in our patients? The truth is that it impacts every single one of these levels that I just mentioned. And so for patients, when we implement trauma-informed care practices, we're improving our patient care and we are reducing the emotional impact of medical care on our patients' emotional health. It has a huge impact on our providers when we think about secondary traumatic stress and reducing those the impact of that. And so it has the potential to reduce burnout and leaving profession. We know that there are several providers who do end up leaving the profession. And so working to mitigate that, it increases your job satisfaction and improves your overall professional quality of life and can also lead to reduced tension with families. When we are kind of managing our own stress as well as recognizing the stress of our patients and reducing the impact of medical care on them, there's going to be a decreased tension. And from an organizational standpoint, and this is a great thing to think about if you are trying to get buy-in from administration or people in leadership to have trauma-informed care trainings. What some of the research shows that these stress reduction programs and implementing a trauma-informed care approach can lead to reduction in medical errors and even reduce malpractice claims. There's some ideas too that suggest that implementing trauma-informed care can decrease the length of hospitalization time. And so there is a kind of this idea that there's cost impact on this as well. And that often gets organizations excited. All right, so returning back to that trauma-informed framework, like I said, we're going to keep coming back to this. And so first, we're going to focus on that realize, which is really thinking about realizing how widespread that impact of trauma is and understanding potential pathways for recovery. So to realize the impact, I like to kind of just share some of the stats that we know from the research about burnout, medical, secondary traumatic stress, and PTSD in our providers. And so I've pulled some rates from a few different studies here, and we know that pediatric nurses experience burnout at a rate of almost 40%. It's a little bit higher in our pediatric physicians at about 45%. And then mental health professionals in the pediatric space ranges from 20 to 40%. If we look more specifically at secondary traumatic stress and PTSD, so kind of thinking about this as like a step up from that burnout, we're talking about like actual symptoms that could be impacting mental health in our staff. So in pediatric nurses across a few different studies here, researchers showed ranges as big as 50 to 78% of our pediatric nurses experiencing moderate to severe secondary traumatic stress. That is really high. There's been some research that has looked specifically at ICU staff, and this included nurses, physicians, and other staff within the ICU. And rates of significant PTSD symptoms were as high as 20% in this population. And then kind of on the opposite spectrum of that, looking at our non-critical pediatric staff. So again, this study included nurses, physicians, and other staff involved in healthcare, but non-critical units. That rate was around the same, about 20%. And so I like to kind of share these numbers because there's a chance that someone around you, if you yourself are not experiencing this, someone around you is, and if they're not right now, they may be at some point in their career. And so this is huge, and it's really important that we talk about this. Um, so I really want to, like I said, highlight that um, not a single person in the healthcare system is immune to secondary traumatic stress. And when I think about this, I like to think about even people who are involved in the environmental teams and, taking the phone calls and scheduling patients, that sometimes they're hearing about different things. And so it truly is every single person that interacts with patients can be impacted by this. But what makes us vulnerable? So as a member of the healthcare team, we are often hearing about patients' traumatic experiences. I feel like this is kind of like the obvious part of the job that can impact us and cause some trauma and stress. But in addition to that, we're dealing with other challenges that are more logistical, like a patient's having insurance challenges getting the medications that they desperately need. Or, we're working in these kind of chronic stressful environments where we're jumping from one room to another, and it's very fast paced. We don't get a lot of breaks. As providers, we may walk into the room with our own trauma histories. The rates of trauma in the general population are extremely high. And so we've all kind of got our stuff. And to think that that doesn't impact us when we walk into the room and walk into other stressful situations, it truly can. And so this is something that can impact us as providers. We generally get into this profession because we're highly empathic and we care about our patients and we want to help them. And so sometimes if we are doing things to our patients that can be really traumatizing for them, or really distressing for them, that's hard. That's really hard. We often have overburdened schedules, overbooked, understaffed. That impacts our level of stress. And then we all have some special experiences with documentation and electronic medical record systems, which I think are fantastic, but do present some challenges. So all of these things kind of make us vulnerable. Oh, and then being a part of the patient's traumatic experience as we deliver care. And so we've touched on that some, but things like administering shots or things to our patients, going through different procedures, all of those things can be traumatic. Even just being hospitalized and being in that setting can be hard on some of our patients. And so that can be really hard on us as providers as well. So we've talked a little bit about realizing the widespread impact. And so I want to walk through a case example of someone, a provider who is on call. And as I walk through this example, I really want you all to be thinking about, okay, now that you realize what secondary traumatic stress is and this widespread impact, I want you to think about, where do you see this showing up for this provider? So this provider is on call. They're at home on a Thursday evening, and they are actually doing bath time with their two kids. And they get the call that, it's short staffed at the hospital and your shift is going to start in 90 minutes. So you start to rush bath time, get the kids in the car, and they take them to their grandparents' house. They're already running late because they didn't have much time and they were right in the middle of their life. So they arrive to the shift, and the nurse says to them and kind of just unloads as soon as they walk in the door. Like, we've been short-staffed all day long. And the patient in room 204 is a 2-year-old male who came in for uncontrolled nausea and vomiting. And what we really need to do is replenish his electrolytes. But the caregivers are refusing the oral medications. We've tried to talk to them, but they believe that he's just going to throw it up anyways. So they are not allowing us to give this patient the oral medications that they need. And on top of that, they have been asking all day to speak with a provider, and we've been short-staffed, so no one has been able to get in there. So this is what you're dealing with when you walk in, right? So the provider goes and enters the room. The family is extremely frustrated because they've been asking to see the provider all day long. And what the provider does then is kind of sits down, tries to stay calm, even though they're still kind of a little bit overwhelmed from just rushing into work and trying to get their kids over to the grandparents' house. But the provider calmly provides some education to the family and really discusses the medical necessity of replenishing the electrolytes and share that, you know, if they're unable to administer these oral medications, then they may have to admit this kiddo into the ICU and do an IV infusion, which carries a lot more risks. And so finally, this family is agreeable. Um, you finish the remainder of your shift, you know, they care for various other patients, but then his provider notices that they're feeling a little bit restless. Shift ends, go home, and they go to pick up their kids. And when they get there, the grandparent shares that your daughter actually vomited last night while you were on shift. And so then you think of this 2-year-old from room 204 and you start to feel really overwhelmed. You start to notice that your heart is racing, you're starting to feel a little bit short of breath, and just feeling a little bit overwhelmed. And so, again, just returning to that question, now that you realize that widespread impact of trauma, where do you see that showing up for this provider? And if there are people on that want to drop some ideas into the chat, feel free. I don't actually think I can see the chat right now. I found it earlier and now it's disappeared. So, but yeah, and if not, just reflect on this. And I want you to think about that. Where do you see it showing up? All right, so now let's move into recognize. We realize that widespread impact. So we know that the trauma is there. Let's talk about recognizing the signs and symptoms of trauma. And so from the trauma-informed framework, this encompasses recognizing the signs and symptoms of trauma in clients, families, and staff, and everyone else involved in the system. So again, today we are really emphasizing on putting the emphasis on you all as providers. But this recognized piece really does encompass all of the levels that we talked about within the system. So when we think about secondary traumatic stress, we think about kind of these 4 different buckets of symptoms which align with the symptoms of PTSD. And so we think about re-experiencing, which can involve intrusive memories or dreams about patients, or kind of just reliving some of those moments that you've experienced caring for your patients. The other bucket of symptoms is changes in cognition or mood. So this could be feelings of numbness or just detachment, an overall change in your worldview and no longer viewing the world as safe. I remember for me, when I first started in the pediatric setting, in the hospital setting, I remember just being overwhelmed by the amount of kids that would come into the hospital following ATV accidents. And I had never recognized that before, but my whole view of ATVs and all those things just completely shifted. And so while that wasn't necessarily a symptom of secondary traumatic stress for me, it was a shift in like my worldview. And some of those things do get to you over time. So being cognizant of that. Another bucket of symptoms is avoidance. So trying not to think about it or ignoring feelings about it. And providers, this could look like calling into work or just not feeling motivated to go in, not returning family's phone calls, or at least trying not to, those kinds of things. And then the last bucket of symptoms is hyperarousal. So the kind of this increased irritability, trouble concentrating, feeling on edge, maybe feeling a little bit jumpy. But these are kind of like our classic symptoms, right? And so in providers, they may not always reach these full levels of these buckets of symptoms. But what I want you all to be aware of is that this can look different for every provider. And so I will break this down a little bit further. And first, just looking at some physical reactions. So these are things that I think it's helpful for us to be aware of for ourselves, but also for our colleagues and the people that we work with. And knowing that if we are noticing some of these things, there could be something else going on. Now, any one of these symptoms, I mean, I think generally we're probably all experiencing some of these symptoms. It's kind of the nature of the work, but as they pile up, they can really start to take a toll. So things like fatigue, sleep disturbances, changes in appetite, headache, getting an upset stomach, having chronic muscle tension or sexual dysfunction. These are all physical ways that the stress can kind of take a toll on us. Some emotional reactions include just feeling really overwhelmed or emotionally upset, feelings of helplessness, feeling inadequate. I think this is a big one for providers who are first starting off in their careers, is just feeling like you don't have sufficient training or you're not good enough. It's a little bit of that imposter syndrome. Um, Feeling just the sense of vulnerability or having increased mood swings, being really irritable, crying, and then thoughts of self harm to yourself or others. Some behavioral things to look out for is potential isolation or withdrawal, feeling very restless, changes in your alcohol or drug consumption, or changes in relationships with others. And that could be both either personally or professionally. I know for some providers, when their job is really taking a toll on them, some of that isolation really can get revved up, and then we're not as engaged with our personal relationships either. And so that can kind of start to take a very pervasive toll. Cognitive symptoms. So kind of just after something, stressful happens, disbelief or feelings of numbness related to that. We may replay the events in our head, just kind of over and over, thinking back about maybe if we could have done something differently for this patient, those kinds of things. It could come out as decreased concentration or just having difficulty problem solving or making decisions, impaired memory, or even distressing dreams or fantasies. And so you can kind of see how these different buckets of symptoms fit into, or I'm sorry, these different kinds of reactions fit into those 4 buckets of symptoms that I first mentioned. So I want to talk briefly about the physiological things that are going on within our body when we are experiencing stressful events, because this does play a role in how we are feeling both physically and mentally. And so I want to just kind of highlight on this slide that our brain is kind of the command center, and the amygdala, the hypothalamus, these are the areas that are involved in kind of our emotional processing. And it communicates with the rest of our body through our nervous system. And so, more specifically, these parts of our brains work together when we respond to external stimuli. And so thinking about, we're in a stressful or dangerous situation. So for example, in the case example, we last talked about walking in to an on-call shift, and the nurse is kind of unloading everything that's happened to the day on us. And we need to now walk into this room where we know the parents are really frustrated. So we're walking into this stressful situation. And then what happens is our kind of senses send the signal to the amygdala, which then sends a signal to the hypothalamus. And that communicates with the rest of our nervous system, which releases these stress hormones throughout our body. And then our adrenal glands pump epinephrine, which is a stress hormone, through the bloodstream. And that signals our fight or flight response. And that fight or flight response causes a lot of really intense physiological symptoms, things like an increased heart rate, blood pressure. You can really just feel it in your body, some of that muscle tension, because you don't have as much oxygen flowing through your blood. And so your muscles are going to start tightening up a bit. And so physiologically, there's quite a bit going on when we enter a stressful or dangerous situation. And this is all automatic. We don't have any control over this. And so when we think about the nervous system, I'm sure you all know about the parasympathetic and the sympathetic nervous systems, but these really are kind of the cornerstones of the stress response in our bodies and minds. And so when we think about the parasympathetic nervous system, this is the system that is responsible for kind of that rest and digest mechanism. It's a signal of, resting and slowing down and kind of more calm. When our parasympathetic system is activated, we are feeling relaxed and good. However, when our sympathetic nervous system is activated, it's telling us to go. It's that fight or flight. And so we are often feeling a bit overactivated or stressed when our sympathetic nervous system is activated. And truly, the goal is for our bodies to have balance between these two systems. And so a stressor occurs, we may have a quick activation of that sympathetic nervous system, but eventually our parasympathetic is going to kick in and pull it back to equilibrium and return to kind of like our baseline equilibrium. However, what we know happens when we are exposed to kind of these chronic stressors over time is the system gets completely out of whack. So our scales are no longer equal. We're not in equilibrium. That sympathetic system kind of goes into overdrive and it can become really overactivated. And this can lead to a lot of physical and mental health problems. So things like the high blood pressure and the increased heart rate, that chronic muscle tension, just feeling short of breath. Over time, these things do impact us. And when these systems are not in equilibrium, it doesn't feel great. However, we are in fight or flight mode. And so we are able to get done what we need to get done. So you can still have this imbalance and be performing in your job. Maybe not your best performance, but you're performing and you're getting done what you need to get done because that fight or flight response is kicked in. And so what I want us to recognize is that our nervous systems do affect the nervous systems of our patients and our families, and our brains are kind of hardwired for this emotional contagion through mirror neurons. And so a like kind of simple example of this is yawning. You see someone else yawn, it triggers you to yawn, right? And so we know that the way that we are walking into a room can impact the way that our patients and caregivers and families are responding. And so this is just important to recognize. So let's go to a clinic example now. And as I talk to you all about this clinic example, now that you know the signs and symptoms of secondary traumatic stress, I want you to think about which of these symptoms are present for this provider and what could be happening from a physiological standpoint for this provider. So it's 10 a.m. on a Tuesday, and Sarah is a 11-year-old female that this provider has been following for years as their primary care provider. And in this well visit, the child discloses that the mom's boyfriend has been sexually abusing her. And although this provider has reported instances of sexual abuse several times throughout their career, this particular patient and this story reminds this provider of Jacob, who was another patient that they cared for several years ago, who they always kind of just felt something was off with the family. I feel like you all probably know what I'm talking about and have experienced that before. But after 5 years of seeing Jacob, he actually disclosed that his older stepsister had been sexually abusing him for years. And so this is a case that kind of really stuck with this provider. And then hearing Sarah's story, this provider got a little bit stuck thinking about Jacob. And however, provider has 7 more patients to see that day. So they're now 20 minutes behind schedule because they were dealing with making a report, navigating that, making sure that Sarah and their family has the support that they need. And the provider has to skip lunch because they're trying to get caught up on the documentation, trying to get back on schedule. And then at 2 o'clock, they see Juan, who is a 15-year-old male that just moved from out of state. And it is this provider's first time meeting this patient. And mom shares that Juan has been making statements about wanting to die for the past week. And so we know as providers, this is not something that we can just rush through. We need to do a safety assessment. We need to ensure that Juan is safe. And so we now get behind schedule again. We had kind of caught, this provider had caught up a little bit throughout lunch. Um, although they weren't taking care of themselves because they worked through lunch. But now they're actually behind again. And so driving home, this provider realizes that they actually never even turned on the radio and they don't even remember driving home. I'm sure we've all experienced that. Some of those like second nature activities. And if we're feeling overwhelmed, we can get really distracted. And so they realized that. And then at dinner, their partner asked how their day was. And they didn't hear they didn't hear them is their side of the story. And so they didn't respond. And so the partner asks again, like, how was your day? And the provider said it was fine and left it at that. So then later that night, the provider's partner actually shares that they're feeling like, the provider has been distracted all day. And when they asked if everything was okay, you said fine, but it seems like this provider's really irritable. Doesn't actually seem like everything is okay. And so then they kind of get into a little bit of a disagreement with their partner. So then that night, the provider has a hard time falling asleep. They wake up in the middle of the night and their heart is beating really quickly. They're kind of just having some racing thoughts and they're thinking about Sarah. But then, in addition to thinking about Sarah, they're thinking about Jacob. And they're wondering if they did enough for Juan and if he's okay or if he needed to be hospitalized for his thoughts of self harm. And so, this with this provider. And so, what signs and symptoms of secondary traumatic stress are present here? Again, feel free to pop your answers in the chat or just reflect on this. But this is a really rich example. There are so many different symptoms that we can recognize throughout this example. All right. So let's move on to our third and fourth R in the framework, actually. So we're going to kind of collapse these two together. And so we are going to talk about responding and resisting re-traumatization. And we do this through implementing strategies to help support patients, providers, and truly, ideally, in the framework, the organization is making some of those systemic changes that I referenced earlier. We'll talk a bit more about that. But how do we respond to this? What do? We realize that, this is pretty pervasive. We know how to recognize it, but what do we do about it? And what I will say is today we are going to touch on this briefly, but there is so much more that we can do. And that really is the focus of the next presentation in this series. So you will get much more on that in the next presentation. But one of the things that we can do when we are thinking about responding and resisting re-traumatization, there are things that we can do ourselves as individuals. And so we're going to talk a bit about that. If you haven't heard of healthcaretoolbox.org, it is a fantastic resource if you are thinking about implementing trauma-informed care practices. And they have some specific resources on secondary traumatic stress. One of the things is this ABCs of provider self-care. And so thinking about the provider and recognizing how do we respond to this? And there's kind of these three things that they suggest. Which is an awareness, balance, and connection. And so for awareness, this is kind of similar to that, like recognizing, but not just like, I think like I described the symptoms, but now what I really want you to do is think about being aware of what your signs and symptoms are. So for example, I have a colleague and may or may not be myself who when they are feeling really stressed and overwhelmed, everyone in the office knows because this person is reaching for the chocolate. That is like a tell, right? So like I know for myself, if I am eating more chocolate, then then I may be having some more stress. My stress levels are high. But thinking about how do you react to stress? What are your signs and symptoms? What are your tells and being aware of that? Monitoring those stressors and then setting limits for yourself. And if you are aware that you are experiencing a lot of stress, getting support for that. Balance is another really important part of provider self-care. And so when we think about this, we're thinking not just about like diversifying the tasks that you're doing in your day and kind of breaking apart your work day, but also creating balance between like your work life and your personal life. Creating balance through like eating sensibly, getting regular exercise, making sure you're getting enough sleep, engaging kind of those basic self-care strategies that set us up for good coping. And then engaging in activities outside of work, using your vacation days. This is huge. Like it's huge. Do not let your vacation days go unused. Use your vacation time. And I think that having that balance and that expectation for yourself, like that each year I am going to use all my vacation time, that helps. And then the last piece of these ABCs of provider self-care is connection. And so again, this is kind of doing the opposite of that isolation and withdrawing, but making sure that you are connecting regularly with family, friends, and community. Finding different strategies that work for yourself, such as meditation, prayer, or relaxation. And then finding ways to disconnect from work when you are connecting with the rest of the world. Some things for that may be, setting some boundaries for yourself around checking your email outside of work hours. And of course, there may be times where you need to make exceptions to that, but trying to maintain that where you can. It may be that, there is one specific thing that you like to do, whether that is, go to some sort of event that occurs on a Thursday evening and you're going to commit to doing, that yoga class every Thursday. And that is kind of a time where like you are not thinking about work. You're not taking any calls. That is important and you're prioritizing that. So I want to just give you some quick strategies that you can try tomorrow. And again, the next presentation in this series is going to really focus on this responding piece and the strategies that we can use as providers to mitigate secondary traumatic stress. But we can't do this presentation and leave you with nothing. And just start at the first two R's. That would be cruel. And so when we think about this, just some simple, quick things that you can try. The first one is just remembering your why. This is something that I feel like has been crucial for my career is, we see really tough cases and we care for patients who have been through some really difficult things. But going back to like your personal why and why this job matters to you and why you got into this space in this career and just reminding yourself of that can be really helpful. Engaging in some deep breathing, relaxation, or mindfulness. Find something that helps you kind of activate that parasympathetic part of your body and puts you into that rest and digest mode. Even if it is just taking a few quick breaths before entering the room or engaging in more formal relaxation or mindfulness exercises. These are things that can help mitigate that physiological response that our bodies are often experiencing related to all of the stress that we manage in our jobs. And so finding something that gives you a sense of relaxation and committing to yourself that you're going to do even just a couple minutes of it. Acknowledging your clinical wins. This, I think, is also extremely important. One thing that our team does regularly is we have one specific provider that at the end of the week, they send a chat in Teams that says, who has clinical wins to share this week? And it's such a nice reminder before we close up our work for the weekend that, we have had some wins and there are some good things happening, even when we had some really tough stuff. There have been some positives too. Another way that I personally like to do this is I actually have a folder on my computer where I have listed some things that have been huge clinical wins in my career. And when I'm having a bad day, or if one of my patients has passed away, I pull that document up and I look at those things just to kind of help me see that, it's not always this hard. There are wins, there are good things. Um, so that can be another way to kind of do that. Engaging in a brief activity that brings you joy. Truly, this can be something as simple as like running to Starbucks, getting your favorite coffee, and but mindfully enjoying it, right? Like you are intentionally labeling this as your pleasant activity, and you are being intentional about it. Like, yeah, I could have a coffee every single day, but it's different if I'm like, you know what? I am going to treat myself to this coffee and I'm going to enjoy every sip of it. So it is being intentional about doing an activity that brings you joy. Participating in physical exercise, again, this is the benefits of this in our physiological system are huge. And so this is really important when we think about that physiological response. And then finally, spending time with family and friends, and connecting with others, making sure that you are caring for those relationships outside of work as well. This is a really great resource. This is the Professional Quality of Life Scale, which is a quick measure. It's about 30 questions that assesses like how you've been doing in the last 30 days. And what is really nice about completing this measure, if you go to the actual Professional Quality of Life website, they have access where you can just complete the measure online. And it will spit out your scores for you, and it will give you where you fall on burnout. It will give you a score for compassion satisfaction and compassion fatigue. And then under compassion fatigue, it has both burnout and secondary traumatic stress. So if you are not good at recognizing your own signs and symptoms, doing a quick check-in with yourself with this measure can actually be really helpful. So this can be a really great resource to just kind of do a quick check-in with yourself. And maybe you just put this on your calendar for once a month, and jump on there, complete it, check in with yourself and see where you're at. This can really help you to know where you need to increase coping. So if you have a higher score, then maybe okay, the next month you're going to set a small goal for yourself, to focus on at lunchtime, recognizing one thing that you're grateful for. The Provider Resilience app is also a really great resource. What I will say is I don't believe that they have a iPhone or Android, like a phone app anymore. This is now and it may have always only been this, but I thought there used to be a version for your phone, but it's a desktop app that you can put on your computer. And so you can look up Provider Resilience. And what is really nice about this app is it has that scale right in it, that professional quality of life scale that I just shared with y'all. And you can complete it right there in the app, and it will track your symptoms over time. So if you do decide to do this monthly, if you do it on this app, you'll get this nice little graph. I feel like as people who are kind of in the professions that we're in, we get excited about like data and graphs, or at least I do. So this is nice for me, so that you can actually see it. And then based on your responses, it will also share some specific coping things with you. So there are some different kinds of more formal like breathing and relaxation exercises right there on the app as well that you can try. So great resource. And then like I was saying, what we just touched on was those like individual things that we can do to respond and resist re-traumatization. But when we think about this, it's important to also think about like what can our organizations do? And some of this may be out of our control, but we can help advocate for some of this. And this is how we really do create that systemic change that is needed to like fully mitigate traumatic stress in the medical setting. And so Our organizations can offer trainings on trauma-informed care, and really normalize practicing some of the strategies that we've talked about. One great way of modeling those strategies can be posting different strategies around our work areas. So, for example, posting something in the break room to remind you to rest and digest, or to engage in a breathing exercise, those kinds of things, but normalizing these practices in our workplace. Some places have some debrief systems in place that can be really helpful. I think what is really crucial about debriefs is being really mindful about how those are conducted. And if you are going to start some sort of debrief system in your organization that is focused on like debriefing after a traumatic experience, being really, really mindful of the fact that in that debrief, we do not want to re-traumatize the providers. And so going through specific details of the case, reliving it can actually cause harm. And so if you are going to start a debrief system, highly recommend doing some research and doing that in a way that is very mindful of the trauma that people have experienced related to the case. There are a lot of wellness programs and employee assistance programs that organizations implement that can be really helpful. And then just modeling that work-life balance and encouraging it. So having organizations that advocate and encourage their providers to use all of their vacation days, those kinds of things. I'm going to very quickly go through this hospital example because I want to leave a few minutes for questions. But so for this hospital example, what I want you all to be thinking about is what could this provider do to mitigate the impact of secondary traumatic stress, and what could the organization do? So through this example, you'll see some kind of flaws in the system, and you'll see some moments where this provider could maybe integrate some of those strategies we talked about. So that's what I want you to be thinking about and looking for. So this provider is working in the hospital. They're caring for 5-year-old Maria, who was admitted for a lot of, various injuries following a car accident. And Maria yells and screams, cries every single time anyone enters the room. But this provider needs to get an ultrasound of her abdomen to check for bleeding. And so, the provider does explain to Maria that, this ultrasound shouldn't be painful. Here's what I'm going to do. But she is kicking and screaming. So the provider cannot complete this ultrasound on their own. And so they ask the nurse to go get more support. So that way they can place Maria in a safe hold to get the ultrasound done to ensure that she's not bleeding in her abdomen. So Maria's hysterical as she's being held. It takes about 20 minutes for her to calm down following the ultrasound. Dad is at bedside. He is tearful. And so as soon as the provider exits the room, they're starting to feel a bit overwhelmed. And they decide they're going to head back to their computer to chart, because that is a nice pause for them. And so they're really looking forward to that quick moment to just do some documentation. However, just as they sit down, they're paged to the PICU where a patient is coding. And then following that code, that's all managed. They manage the code. They're heading back to the workstation again, but a family stops them in the hallway, asking for a warm blanket because their kiddo's cold. And so they're pulled into that. And so thinking about this, this is something that I feel like as provider, we've probably all experienced similar situations to this, but what could this provider do to mitigate some of the impact of secondary traumatic stress? Which of those strategies that I talked about might be helpful, and how could they use them? And what could our system or organizations do to help mitigate the flow that is happening here for this provider? Okay, and that is all that I have for you today. I'm going to hand it over to Jen to talk about the next training and kind of wrap things up. But I am also happy to take questions at any point.
Thank you so much, Thomas. That was absolutely wonderful. It was just so terrific to take through so many great examples, and also all the research behind the work. If anyone has any questions, please feel free to put them in the chat. Very glad to take them. Well, we still have everyone on. And for everyone listening after on the recording, really glad to have you watch as well. We are so thrilled to have this partnership with the Minnesota chapter of American Academy of Pediatrics, and we are going to be doing a 5-part training series. So this is part 1. Part 2 is happening on June 26th, which is really, really focused on strategies for mitigating secondary traumatic stress. So Tess did an amazing job of kind of giving us the overview today and some strategies. We're going to really dive into the strategies in this next session. So really hope folks will join us for that one. And then in the fall, we'll be doing 3 sessions specifically focused on pediatric medical traumatic stress. So kind of what it looks like in patients and patient families, and how we as providers can support families through those experiences. I don't see any questions coming up. So Jeff, if you have anything to add, please do.
Jen, this is just a quick reminder to put the evaluation link in
Yes.
the chat.
Oh, thank you so much, Tess. Yeah. So thank you. I would have totally forgotten that one. So we also are asking if everyone would please just take a couple of minutes and fill out this evaluation about today's presentation, just to give us a little bit of feedback. As Jeff mentioned, this is a collaboration between Minnesota Academy of Pediatrics alongside Network, and then funded by Minnesota Department of Health. So really excited to kind of get some feedback on what you learned today and how you experienced this, and then we can kind of shape going forward after that. Thanks, Ted.
Yeah, and I'll just say I know we're at like the end of the hour here, so if anyone is watching this later, or if questions come up, our emails are up here. Feel free to send me an email. I'm happy to answer any questions that you might have.